Hi there. I want to talk to you about the medication area inspection checklist. This checklist is really important because it helps you to cover all areas of the required pharmacy consultant inspection. So once you've gone through this checklist, you will know that you've covered everything that needs to be covered during your audit. So let's back up here for a second. So you have now arrived to your surgical center. First time you're going in to do an inspection. My first time I was a little nervous because it was my first time. I'd never done it before. And but I knew that I could do it, and I had my checklist. So up to this point, we've talked about when you get into the facility, you contact the director of nursing, the administrator, let them know you're on the premises and you're there to do their audit. You've already talked to them about any concerns they may have. And now you're ready to perform your checklist. It is really important to follow your list. You could, based on the layout of the facility, as you become more used to the facility, you may want to move some of this information around in a way that fits you best. But the most important thing is when you get into the facility, you want your audit to be efficient and you want to be able to know that every area is covered. So if the facility gets an audit, that you have done your due diligence and you don't have to be concerned that they're lacking in any area that is your responsibility as a consultant pharmacist. This checklist will, like I said, also help you to get through each and every area of inspection in a very efficient way. Having said all that, we will go through the checklist quickly, and it's really self-explanatory, but I will go through it with you. So the first thing I do, I find out where the medication storage areas are, and I'll check to make sure that there are no expired medication in the facility. If I see a vial just randomly sitting around, I'll pick it up. I'll ask, is someone using this? Why is this here? Etc. So you basically look around and make sure that the medications are where they should be and they are being stored where they should be stored. I also check to make sure if I'm going through my audit and I see a random medication, like I see it's an ortho facility and I see medication there for eye drops and eye supplies, I would question why do we have this here? Are we now doing eyes? And if so, then we need to have a conversation about that, changing the formulary, etc. So you want to make sure only authorized medications are in the facility for the treatment that's being rendered there. If they're sample medications, make sure that they are properly labeled with expiration date and all the pertinent information. You also want to make sure medications that require special storage are stored appropriately. A medication that should be protected from light. One of the ones I find is the albuterol for the nebulizer solution. They come in little packs of 5 and they should be stored in their full package because once open, they need to be protected. That full package is open, they need to be protected from light. A lot of facilities are not aware of that. I educate them on that and we move on from there. Some medications like diltiazem, famotidine, medication that needs to be stored in the refrigerator, stored in there. Moving on, medication, list of recall drugs, making sure that there is a way to account for recalled medication, which does happen. And so there should be a separate binder or a tab in the pharmacy book that shows how recalled medications are handled, because that needs to be documented. Also, making sure that single medications are not reused. So, for example, if you are going through your medication check and there's a vial of medication with a beyond use date on it of 28 days from when it's open, but also it states on the vial single use drug, then that needs to be discarded because it's with the date on it and it's being stored, they're using it as a multi-dose and it's not. On the other side of that, if there's a vial in the facility, in the medication storage area, and it's open, it's a multi-dose, but there's no date on it, then that has to be tossed also because we have no idea how long ago it was open. We also want to make sure that reconstituted drugs are labeled with their reconstitution date or their beyond use date. Next item, if medications are reconstituted, you want to make sure that it's appropriately labeled with the concentration. Moving on to controlled drug medications, you want to make sure that they're stored securely. You do not want to walk into a facility and find the narcotic cabinet open for anyone to help themselves. What I can tell you, my experience has been that the facilities I work with, they're very much aware of medication safety and security, and they are very good about keeping close control over the medications. You also want to check the anesthesia records to show that if there's waste, or the PACU records, if there's waste, that there are always two signatures and that the count is correct. I encourage you, when you do your narcotic audit, that's where you will have a separate training on that. But during your narcotic audit, that is something you do not want to do by yourself. You want to make sure you have another person with you, a registered person, an RN. Moving on with the crash cart, we want to make sure that the crash cart is sealed and it's intact and that all the required medications that are present are usable, that there are no expired drugs in the crash cart. And that has its own separate log, which you can check. And on that log, it should have a number of what the lock tie should be, and you make sure that that matches. The crash cart is really key because you want to make sure that when you have an emergency and you check the crash cart, that everything that's supposed to be there is there to handle this emergency. You want to check the refrigerator, make sure that the thermometer, it's a thermometer, you want to check the temperature right then, make sure that the temperature is where it should be, which is between 36 and 46 degrees Fahrenheit or 2 and 8 degrees Celsius. You want to make sure that the medication refrigerator log is present and that it is complete. And the medication, you want to make sure it's free of frost and that it's clean. And there should be no food or non-drug items stored in the medication refrigerator. Make sure that the drugs that are used to full stock are kept in locked storage or in a secure area. Your DEA 222 forms should also be kept in a secure area. They should not be available for just anyone to have access to them. And again, going back to the crash cart, we want to make sure it's locked and it's stored in an area which is visible. You don't want it down the hall, to the left, into a room. You don't want it there. You want it to be visible, so if there's an emergency, it's very accessible. Generally, you want to look around at the facility, at the counters, the working area. You want it to be clean, neat, and well organized. Why so? If the state walks in, the attention flows with this organization, where it shows that things are just thrown on the counter. So you want to make sure that the area is clean, neat, and well organized. You want to make sure disinfectants and externals are stored separately from internals and injectables. If there are flammable and combustible substances around, you want to make sure that those are stored properly. So you want to make sure that there is a system where if there's a conversion needed for measurements or dose, that there is some type of a chart accessible to the nurses that they can quickly do that conversion. You also want to make sure that the Poison Control Information Center phone number is posted in the facility and that everyone knows where it is. There should be a note on the refrigerator door that states not for storage of flammable liquids. Now, moving on to documentation, you want to make sure that the facility are holding on to the invoices, packing slips, and pedigree for all legend drugs in the facility. They should also have, this is documentation, the procedure for contacting a pharmacist in an emergency. Emergency drugs we covered, the crash cart antidotes, that should be in with our regular uh, medications. So for example, if we're using opioids in the facility, we should have Narcan available in the event there is some type of overdose issue. We should have a formulary list of drugs in the facility. And of course, if that changes, that needs to be updated. If we add something to the formulary or if we take something off the formulary, our formulary should be updated at least once a year. Guidelines for preparing sterile parenteral drugs and solutions, we should have those in the facility. Interaction or contraindication information for medication. In other words, we're looking for adverse drug reaction. If something happens, how do we track that? Beginning and perpetual inventory counts, that's in our DEA audit that we did earlier. And the DEA, making sure that the facility DEA license is up to date and their pharmacy permit is up to date if they're required to have one. If there are any follow-up meetings that are required from the Pharmacy and Therapeutics Committee. And you want to make sure that the power of attorney is up to date. That way you know who exactly is responsible for ordering medications and who the person is that oversees the facility's medication management program. Making sure also the consultant pharmacist license is posted and up to date if a pharmacist is required or a pharmacy nurse. Making sure that there are two patient to identify system in place. We also want to make sure that any unapproved abbreviation system that we're using, that we have a system in place for that. Now, in this section here, this says list medications that will be expiring in the next 30 days. What I do to help me to efficiently go through the facility, I do not necessarily go through each and every drug every month when I go. What I do, and I have a separate training for that, I have a list and it has the 12 months of the year and I go out 6 months. If I go through my medication audit and I see a drug that will be expiring 3 to 6 months, I will put it on the list for that month. So when that month comes around, I will look for those drugs to make sure that they have been pulled. And if they have not, I will pull them myself. And I'll also let the staff know. This section here for medication that's going to be expiring within 30 days. So let's say my visit is, it's already the 10th of the month and something will be expiring. Let's say we're in December and December 15th, but there's a medication expiring January 1st, 2019. I would put that medication on this list and I would bring it to the attention of the nurse and tell them, hey, this medication, the list of these medications will be expiring before my next visit. Would you please make sure you pull them at the end of the month? Sometimes they will say, you know what, we already have the new stock. It's not something we use a lot. I'm going to pull it now so we don't miss that cutoff. And so that's fine. But sometimes they're high price medication that they may use. And so why get rid of them until they have to? So I would put those medication names here. And then at the end of the visit, basically you will write the record findings that you found, things that you found that what you call deficiencies, and how to improve them as soon as possible. And this is the section you would do that. Generally, I would put if I found something that's expired, or I found something that was, if I found the facility was there were too many things on the counter, on labeled medication, I would make a note of that here. But in an effort to educate, not necessarily to be punitive about it. Remember, I'm here to help them be better. and that's my role. And so I would put that there. But generally, in my comments, it would be the facility is in compliance, and then I would list whatever things that I found that think needs to be brought to the attention of the director of nursing and the administrator. I then write my name here, sign it, and date. And that is how I would go through the inspection. Again, this checklist is very, very valuable. It will help to give you the confidence that when you go in, when you've gone through this checklist, you will know that you have done a good job for the facility. You will leave a copy of this checklist in the facility, in your facility binder. You may also make a copy and bring with you. I usually keep them for 3 to 6 months until my quarterly meeting, and then I will discard them. I hope you find this helpful, and I'll talk to you later.